I guess we will call the meeting to order. Carrie, would you do the roll call attendance, please?
Commissioner Cade,
Here.
Commissioner Johnson,
Here.
Commissioner Kelly,
Here.
Commissioner Oakes,
Here.
Commissioner Ertley,
Here.
Commissioner Schreiber,
Here.
Commissioner Sloan Buchanan.
Here. Thank you. Now will please rise for the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The next item is public and employee comments. Do we have any, Carrie? Okay, thank you. And then the next item is the local 3438 report. Thank you, Kurt. Oh, yeah.
Smarter than the microphone, which I am not. Good afternoon, commissioners, admin, public, staff. So a couple things from the union tonight. First of all, Santa Run going really well. The admin had a couple nights, was very successful. All the shifts so far have been out there hitting the ground running. Turnout's been a little bit low from the public, and I think there's just a lot of pressure from the economy right now. People are having a hard time, but we're still collecting. It's going well. From just the local standpoint, as I said last meeting, 3438 does a big drive within the members to collect money. Currently, we've collected about $3,000 to support 10 needy kids in the community, including there's 3 special needs kids and some single parents in there where they're really struggling. And the local has identified those people, and we're getting them a pretty robust Christmas. I know Teresa, or is that back there? Thank you, Teresa. She gets a bicycle donated, a couple other things. So we're gonna get 10 kids in the community a pretty great Christmas. Moving on from kind of what's going on with local, just want to remind everyone we're going on about 9 months now for negotiations. We're really looking forward to a response from the administrative negotiation team on our financial proposals, so we can kind of, in the words of Richard Davis, cut bait or fish, right? We got to figure out what we're doing here, so we're looking forward to that response in January. I can just shout too. Okay, it's on now, allegedly. There are some big issues that we need to address in 2025. The labor group understands that it's the holidays, and we don't want to charge into the holidays with a lot of stress and stuff going on. So we're looking forward to some big issues that need to be addressed and talked about, and some changes that need to happen within the agency. But for the holiday season, we know that family is important, and we want to put it all on a pause so that we can all focus on what's important, right? Because this is work. We serve the community, but this is work, and we want to make sure that we're respecting the fact that all of us have families and lives outside of this stuff. So the locals putting a pause on any other stuff we have on the docket now, and we'll come back to you in January and have some more robust discussions. That's about it. Just wanted to say thank you for your time and your consideration. We've been through a lot in the last few months, and we really appreciate the leadership and the work that everyone's put in. And the local will just want to say happy holidays. If you have any questions, I'm here.
I don't think so. Thank you very much.
All right, thank you.
Merry Christmas back.
And now I'm off to go do the Santa Run.
Good luck. Have fun. The next item is I need a motion to approve the agenda as presented.
Madam Chair, I'd like to make a motion to amend the agenda by moving a special agenda item with guest presenters, item 8 to number 6, and then subsequently adjust all the other numbers 6 to 7, 7 to 8, and so on down.
Second.
All in favor?
Aye.
Anyone opposed? No? Okay, that amendment passes. Okay, now the commission will now meet in executive session to discuss
No.
with legal counsel matters related to.
No, the special agenda item is next.
Oh, we did it. I'm sorry. I put it in the wrong place. Okay. So we'll have our special agenda item. Thank you.
Okay.
Need to draw my arrows in the right place.
Good evening, Commission, and thank you for moving this forward on the agenda. Two of our three presenters have other engagements tonight. So tonight on your agenda item, there's an agenda item that has been, this is over a year's worth of work. This project started about 18 months ago, and this morning I had to drive up to Mount Vernon, and I was reflecting, trying to just think back to how we all got started on this. And I actually reached out to one of the people on the task force, I'll mention in a minute, Chief Maxwell from South County. I said, Sean, this is what I'm remembering. Like, go through this timeline with me. And we talked through it, and we kind of laughed because we're like, we've been at this so long that you kind of forget what the initial steps were. And so this is a really important item. And I reflected on it today thinking the commission has not had something presented in front of them with as much work and effort put into it as this since the RFA, all the documents that were approved in the RFA. So this is a really big deal. I'm just going to give a quick overview. Then I have three presenters who are just going to kind of talk from their perspective. They're part of the task force. So I'm going to introduce Chief Dave DeMarco from Everett Fire Department. Just wave your hand there. Snow 911 board member and Snohomish Regional Fire Commissioner Roy Waugh. And I will just point out that Roy has been a fire commissioner in the state of Washington for 30 years, 33 years. And lastly, our Dr. Ryan Kay is the Snohomish County Medical Control Physician. So kind of the background on this is in the spring through the fall of 2023, Snohomish County Fire Chiefs contracted with the Burke Consulting Group out of Seattle to provide a report on regional opportunities relating to fire, EMS, and training. This was a competitive request for proposal process with multiple submittals. Burke was awarded the contract. The report provided the opportunities to the county fire chiefs to consider exploring lots of different things. It had like 4 or 5 main topics. They thought these are ways that you can collaboratively begin to work more collaboratively throughout the county. The determination was made that Snohomish County EMS is the priority. Kind of the backstory is that when I was reflecting on this with Chief Maxwell this morning, is Snohomish County EMS has been broken, underfunded, and understaffed for about a decade, maybe more than a decade. We could reflect back, and essentially we used the word this morning, homeless, in that Snohomish County EMS has bounced around to several different places that have housed it over the last decade, including its station here at North County. It was at Station 96 for a few years. They leased some space up there, but it was Chief DeMarco housed it for many years in Everett at the office building on Oaks. South County housed it for a few years, and then we housed it. So they've kind of been bouncing around the county without like a really established location and established leadership. It was essentially a one-person staff, a one-person model that was not meeting the needs of a county approaching a population of almost 1 million and not meeting the needs of the agencies and the providers doing all the work in the county. Just remember, this is 86% of what we do is EMS related. So a group was assembled. This is right after I took over as president of the Fire Chiefs Association, and so it was one of my first tasks was assembling this group. And the group that was decided was in no particular order: Terry Mills from Snohomish County 911, I got their names backwards. Terry Peterson at Snow 911, Kurt Mills at Snow 911, Roy Waugh as a Snow 911 board member. Chief DeMarco is a Snow 911 board member. We had to represent all the agencies in the county. We break them up at the Chiefs Association as small, medium, and large. So Chief Sean Maxwell was the large agency representative representing South County Fire. Chief Don Waller was the medium agency representative from Snohomish District 4. And Gary Lingle, that works here for us at North County, is also the assistant fire chief in Darrington. And Gary was the small agency representative, as well as Dr. Kay as a Snohomish County Medical Control Physician. Scott Dorsey is the interim director at Snohomish County EMS. Chief Joe Hughes is Deputy Chief Joe Hughes as the Snohomish County EMS Board Chair. And then some of you may remember Karen Reed was the consultant we used in for the RFA project. Karen was the consultant that was used for this project also. And I believe this was, Dave or Dr. Kay, was this Karen's last project? She's officially retired now?
I don't know if you can say last for sure, but she did technically retire.
Yeah, I think so.
The last meeting she phoned in.
Okay. Okay. So this has been over a year's worth of work. I was reflecting, they were meeting, the task force met twice a month for essentially a year. Chief DeMarco and I were reflecting a moment ago that this is an individual commitment from each member on the task force of 80 to 100 hours in meetings to get us to this point. And so what you have before you tonight is the interlocal agreement that all the agencies in Snohomish County need to sign to be part of. So we're one of the first agencies in the county that's bringing it to their commission. I think most of them are bringing it in January and February. The goal is that this new organization will stand up on April 1st. There's always the question, did this get legal review? And it did. Matt Paxton from CSD Law was part of he was involved in all of the meetings and drafted all of the documents. So everything you have before you tonight has had legal review by Matt. So I'm excited to hear the three of them tonight. So I will first introduce Chief Dave DeMarco.
All right, so I know what it's like to sit at a table and be held captive by a speaker, so I'll be brief. Fun fact before we start, Roy Waugh, in addition to being a marathon commissioner, was the director of paramedic training when I was at Harborview in 1997, and I tried to walk out on him once, and he saved me, so just a little, there's more history than you might guess. So I'll just start with a little bit about how we got here. And I think first, the distinction is important for you to hear that when we talk about Snohomish County EMS and the problems that lived inside of Snohomish County EMS and still do, we're not talking about your providers. All right, this is not about the service that's occurring on the street when somebody calls 911 and your providers arrive and they deliver a level of service that you govern. All right, we're talking about the layer of oversight that exists in state law as envisioned by the Department of Health in delivering EMS as a system. And in Snohomish County, for those of us that manage the relationship with the state for our agencies and for the county, I think I can say with some certainty that the Washington State Department of Health views Snohomish County as one of the worst organized EMS systems in the state. And again, that's not about the delivery of service at the street, it's about the oversight layer that lives in the county. Different counties in the state manage this in different ways. We've looked at all of them. These hundreds of hours of meetings that you're talking about that Chief Kraske mentioned are, many of them were deep dives into the bureaucracy of the law inside of Washington State. And I'll just summarize by saying that the existing Snohomish County EMS does not meet the statutory requirements of the state, that we have been out of compliance for all of this time, and there's been a myriad of crazy things. You may remember somebody hijacked the county's Facebook page. There's tax returns that weren't filed. There's providers that have had to carry records around in shoe boxes. There's been a lot of things over the years that go with this dysfunction. And we're now a population of 850,000+ people in this county. And honestly, they deserve better. And so I was asked to participate in this. I've been in the fire service for 30 years. I served as a paramedic I kept my cert for almost 20 years. And I care very much about that portion of the service that we provide as an industry. That the delivery of EMS is important to the Everett Fire Department, and it's important, I'm sure, to North County. And I wanted to see this thing through to bring us into a place where we can say basically that we're statutorily compliant, that we are not an oddball in the state, and that the providers of Snohomish County are consistently supported in a way that is sustainable and scalable as the county grows. Okay, because we're not going to stay at 850,000. You all know that. I'm sure you're experiencing growth here. There's growth everywhere in the county. We can't seem to stop the migration from other states into Washington State, and so the population is going to continue to grow. So we had to build a system that's scalable and that will adapt to the future. We looked at a variety of options. We started by asking, okay, what is the requirement that the state sets forth? And we laid out in these large bureaucratic tables that are not included in your slide deck in your packet. You're welcome. And we looked and we all, I don't know how much you follow what's going on in Everett, but I represent an agency that is extremely frugal. All right, I would imagine that you are too, but we literally count every penny, all of the time. And we were tasked with building a system that is statutorily compliant but not extravagant. Okay, I always describe the Everett Fire Department as a Chevrolet fire department. We don't buy Cadillacs at the Everett Fire Department. We buy Chevrolet quality equipment, and then we drive it to death. All right. The proposal that is coming before the county boards of commissions now is a quality proposal, but it is not an extravagant proposal. And it is built around some of the same limitations that you face as a board of commissioners in terms of funding. So the proposal is to stand up a new agency and to have that agency funded by a fraction of a penny of your EMS levy. And that there's a variety of safeguards built into the interlocal agreement to maintain the cost growth to a limited and manageable level so that you can't have runaway costs in this new agency. But that it will be successful in actually managing and delivering the level of administrative services that are expected of a county our size. I have with me tonight Commissioner Waugh, who is from Snohomish Regional Fire and Rescue and has more on his resume than just being a commissioner. He is passionate about EMS also. More importantly, I've got Dr. Ryan Kay with us here tonight too. She is the county's medical program director. She sat as an observer in all of the development of this proposal. She is the person tasked by the state with all of these responsibilities, and understand that the state produces this massive list of responsibilities for medical program directors and then says, you figure out how to build it and fund it. All right, the state offers no dollars, they just offer requirements. And so she is faced with this long list of requirements. She's inheriting an agency that is non-compliant with basically all of them. And she has worked with us to build this proposal into a system that is Chevrolet cost, scalable as the county grows, but also effective so that we can come into compliance with state regulation. I don't know how I'm doing. I might stop there and just see if Commissioner Waugh wants to add anything and then let Dr. Kay speak, or unless you have questions for me.
Guess not.
All right.
I want to, the last time I made a presentation to the county commissioners, Steve Fox yelled at me because I went over time. And the one thing that we did not do a good job of doing was, because everybody has a good EMS delivery system with their different departments. You keep track of this. It's not a secret. The fact that most commissioners didn't know there was a problem. So I stepped into this kind of sideways because I brought up at a Snow 911 meeting that there wasn't any elected officials going to be on this committee. Not thinking about me sitting on the committee, which someone immediately volunteered me to do that. So my background, you heard a little bit about it. I've got a passion for EMS. I entered in the fire service in 1971, was a paramedic in Seattle. I retired from there, became the director of paramedic training at Harborview, University of Washington. And all during that time, from 91 on, I was a commissioner because I got talked into that also. I've been on the Regional EMS Council, the North Region. I've been on the Snohomish County EMS Council, Snow 911. I've covered most of the areas. And yet I've got to say that I'm most passionate about it because I got to work very closely with Dr. Michael Kopis and Leonard Cobb in Seattle. And you can call him the father of the EMS. They contributed a lot, but there was a lot of, everybody does it a little bit different in their different regions. I was always felt really bad because I've lived in Snohomish County all these years, and I always felt bad because we never did a good job. Far more than 10 years, we haven't done a good job. We have not supported the big picture of EMS. The departments, leave them alone. The chiefs and the firemen will find a good way to deliver EMS for the citizens that they serve. But there needs to be a major oversight of that program to make it efficient. What you see in front of you in regards to the WAC that Dr. K has to administrate is an impossible thing to do without leadership and additional guidance. They didn't have that for so long. There was no one that was really tuned into that. So when the chiefs, because they realized that they weren't doing the best job they could, they all did their good jobs individually, but trying to put the big package together, they're too busy to watch this and have the oversight that it needed. So in building the governance model that we built into this plan, and it goes into great detail in the ILA, is that each department will be represented, both small, medium, and large, and there will be one position for an elected official from either the fire agencies or the two cities that still provide Everett and Mukilteo. They will have a caucus and they will pick one elected official to sit on this committee. So in seeing how this had been done in other counties and funded usually at a county level, a lot of people in Snohomish County didn't want the county controlling the EMS. It's that simple. I'm not a very politically oriented guy. I usually say the wrong thing a lot of times, but I'm sorry that they never funded it. They've never tried to fund it. They didn't want to fund it, even though it's mandated that they're supposed to administrate this. So the chiefs took it upon themselves. They did that. So what we're trying to give Dr. K is an ability for validation of the RCWs that she's supposed to enforce, and they try very hard to do what they've done in the past. But there's no good quality management plan to bring it all together. There's no good data management plan to develop better quality assurance and improvement. There's nothing. We could be doing a better job. And as elected officials, I think it's our job to do that. Now, and it's not that we shirked our duty. I don't think we were given good ability to direct our energy in the right way. Now we've been able to go through all of this, and Chief DeMarco is correct. We picked it apart in every direction you could, tried to make sure we could find no loopholes that would get us in trouble down the road. So we feel it's a very good model. There's a number of things we wanted to tackle, but realized politically we had no power. But given the new governance model, they will have the power to be able to enforce. The one thing was delegate physicians. There's a huge amount of money going to these physicians that aren't effectively being managed to give us our bang for our buck. So at some point, this new governance model, we would want the board to bring all those delegate physicians under a single umbrella, because the different agencies are paying these doctors. Some of them are getting paid more than others. Some of them are more accountable than others, but they're not all answering to Dr. K like the law says they're supposed to. So I'd answer any questions you might have. I'm passionate about this. I could go on and on and on. But this is something that I felt strongly about for a long time. I think it's the right direction we need to go. It might look like a lot of money. Most counties, I think the smallest budget we looked at in other counties in the state was like $8 million. Some of them are twice that. So Dr. K has to certify all your people. She has to do this whether we give her the ability to manage it or not. She still has to do it. I don't know if any of you go back a long ways, but Marsha Parker was the secretary that handled everything in Snohomish County at one point. And she got it done then. But there are so many more mandates that have come out from the state without funding and or good guidance on how they should be doing them, we have to take it now and do a better job of managing that at the 10,000 foot level and support Dr. K in this. Any questions I can answer? Thank you very much.
Thank you.
Thank you, Ryan.
Thanks for having me here. I just briefly introduce myself since you guys probably don't know me. I'm Ryan Kay. I'm an emergency medicine physician. I've been at Providence for 15 years. I was the medical director of the emergency department there for 7 years, and I'm the chief of emergency medicine now at the hospital. Originally from Alaska, where 28 years ago I was a flight medic before going to medical school, so have my roots in EMS and kind of rural medicine. And I was very honored when I was approached to be asked to interview for the position of MPD in Snohomish County. I was the delegate physician at Lake Stevens Fire and then surfer for a period of time, and then stepped back from that for a couple of years, and then was excited to take on a challenge because it's really been a challenge. I will say that when I took over, there was no handoff. There was an MPD handbook from the state that was written 15, 20 years ago, and really no orientation as to what happens next. And that's the kind of challenge I like the best because it's kind of fun. There's 3 tenets that we've sort of built or are trying to build Snohomish County EMS on, and that is building trust, supporting our providers, and building systems of care. And what I'm really passionate about is supporting our providers, because we have really excellent people out there providing patient care, taking care of our community. I live in the community. My mother lives in the community. My just recently passed 100-year-old grandmother lives in the community, and they have received excellent care here in Snohomish County. And I want to make sure that we are maintaining, elevating, keeping up with that level of care, and keeping qualified, passionate people. And people stay, we retain these people when we have systems that are effective and we have trust in a system. And so I think that is really needs to be the focus of our goal. I can talk about all my dreams and what I want to do and how I want to build training. But I really want to focus on kind of where we went, which was an office of nothing and sort of part-time people, to where we are now, to where we want to be. And so we've already talked about where we went. We've talked about regulations and governance, but we've done some amazing things in the last year and a half. We've rebuilt our paramedic onboarding and mentoring program. We have focused on our areas of risks. We had a lot of risk around our quality management and quality improvement processes, and we have streamlined those and been compliant with HIPAA and tried to bring people all on board with these new processes so that we aren't exposed to any risk in our community. We have developed, or not developed, I didn't develop them, but we have revised and elevated our protocols, which had not been revised in quite a bit of time, to really bring our EMTs and our paramedics up to the point where they're practicing at the top of their license and providing excellent pre-hospital care. Pre-hospital care has changed so much in the last 30 years. We're not just scooping patients, throwing in tubes in the airways. We're really managing critically ill patients. We're managing ventilators. We've got patients on drips. And we have things that are time dependent and intervention dependent in terms of disease processes. We have sepsis and stroke and trauma. We have falls, which we have an incredibly high fall rate in our county. And these patients who fall are high risk, especially if you're over 65, of having significant injury. And so everything we can do to really elevate our protocol, support our providers, and provide the best care to our patients is critically important. And so the last part is really building trust. And that's another part that's really fun for me, is I love the FaceTime with people, going around to every department, meeting with our medics, with our EMTs, talking. I hold quarterly county run reviews, of which almost a quarter of our providers in the county attend every quarter for the county run reviews, which is amazing. We have great dialogue. People speak up. I send out Monday Minutes every Monday with just little educational pearls for all of our providers. And this is all with minimal structure in place for our county EMS office. We've been able to revamp our credentialing and have gone from a backlog of several months of waiting to re-credential providers to being able to do it within 24 hours. So we're credentialing providers as soon as their records come up, and we've got put systems in place to kind of take out that lag time and that person-dependent process by developing those systems. So that's what we're really passionate about. We can do more. We really need to not be kind of little groups of providers here and there. We need to start training together and thinking of ourselves as an EMS system, because frankly, if you're traveling in the county, you should get the same care if you're up here on I-5 or you're out on East County on Highway 2. No matter where you are, you should be getting the same quality care. And the only way to make sure we're working together is to train together. And then finally, I have a vision of really building out an area of weakness that we have, which is our data. It's hard to make improvements without data. We're trying right now to get a countywide blood program for pre-hospital trauma. We'd like to look towards pre-hospital antibiotics for sepsis to reduce our mortality in sepsis, but we need data to support that, because all of those things cost money and use up resources, and we can't prove effectiveness. We don't just start things without knowing what we're doing and proving an outcome, and so we need to prove that effectiveness. So building trust, supporting our providers, and developing systems are really the focus of what I want to do moving forward. And I could keep going on and on. There's so many little buckets of work that I'm excited about. But I'm happy to take any questions if you have them about anything that we're doing or where you wish we were going.
Do we have any questions?
Just input, not necessarily a question. Dr. K hit on some very key points that I really value. They've been great partners to us, and we've just went through a strategic planning session in the last week. We've had three days in a strategic planning session, and some of the measures that we'll be following up on and putting into our strategic plan is on the sepsis data, on the falls data, on the stroke data, and on the cardiac data, and we'll be measuring that, and that's how important that data is for us. Matt Hickman was able to pull up some data while we were inside of our strategic planning session to show us what our ROSC rate was and our Utstein rate was, and being able to measure the two of those and put a measure for us to go back to the community to do it. So all of this stuff is huge. I'll finalize with my statement is the cost. Chief DeMarco might shoot me right now. But the cost is fairly minimal, in my opinion, for the amount that we'll be getting from this, and it's recoverable as long as GEMT is around. It's recoverable through that, because we have a responsibility to manage our EMS program effectively, efficiently, and to the highest level for our consumers. So we'll be recovering some of this money, but I am happy to say they put in a scope, because I was in favor of coming back with the Cadillac plan. And I support the entire group with the Chevrolet plan, but even the Cadillac plan, they have goalposts in there that they can't go over a certain amount. So this can't be a runaway train for people that have budgetary concerns. So from a budgetary standpoint, I just want to point out that right now they've taken a very, what I feel is a good position to have growth if necessary when they get their board in place and do what they're going to do. I feel like they have the bandwidth to be able to expand, as what I think Commissioner Waugh and myself both believe in EMS. So with that, it's more of a comment in support of Dr. K and the team. And thank you guys so much for the 80 to 100 or 1,000 hours that I know you put in, because Dr. K, a side note, will show up at our training center on her bicycle, riding all the way from some lake down in South County. So she just popped in every once in a while.
I will just briefly close this out. So in your packet is the 40-page ILA. I hope none of you actually spent time reading that page by page. Matt Paxton provided a 4-page summary document of the ILA. That's really a great document to read if you had interest. But again, to give you a little level of comfort, Matt was involved in this from start to finish and drafted all of the documents for all the agencies in the county to sign. So the recommendation tonight would be for the board to approve Chief Cermak to sign the ILA, and we will move forward. The goal is for this new organization to go live on April 1st, after we nearing in on almost 2 years of work at that point. So happy to answer any questions.
I don't have any questions.
Yeah, I'd like to make a motion unless there's one already written somewhere exactly.
No.
Okay.
I just have one question.
Go ahead.
Is everything good, Randy, with budgetary wise?
Yeah,
It seems like it's not much.
had this in our forecast for next year's budget, and we've
Okay.
already budgeted appropriately for the increased costs.
Okay, great, thank you. Any other questions? Rod?
I'd like to move to adopt and approve the interlocal agreement with member agencies for a Snohomish County EMS agency as presented.
Second.
Okay, we have a motion and a second. All in favor?
Aye.
Anyone opposed? That motion carries. Thank you.
Thank you. I'm going to walk our guests out for a moment, then I just want to plan to see, depending what time the meeting gets over, Autumn, our HR, one of our HR people, and I, we have to be, this morning at 8, we were up at Skagit Valley College to talk to the fire science program, trying to recruit some part-time members. Tonight at 6, we have to go talk to the EMT class. So if you see me kind of pack up and walk out at like 5:25, it's no disrespect.
Okay.
Thank you.
Thank you.
Okay.
Thank you, Ryan.
Okay,
Now executive session.
now, sorry, guys. The commission will now meet in executive session to discuss with legal counsel matters relating to collective bargaining as allowed by RCW 42.30.140. The commission will be in executive session for 15 minutes. So, okay, we will return in 15 minutes. Okay, we'll call the meeting back to order. We're out of executive session. And the next item is I would need a motion to approve the consent agenda as presented.
Second.
All in favor?
Aye.
Anyone opposed? No. That motion carries. Thank you. Okay, then we have our quarterly division presentation. Matt Hickman?
This seemed to work. Are we good? Yeah. Oh yeah. I mean, it hasn't worked for years, but it's here. Yeah.
Proper attire.
I think it's got batteries in it. Yeah. Good evening, members of the commission, those online. My name is Matt Hickman. I'm the interim MSA here at North County, and just newly appointed as of November 1st. So my quarterly report is not going to be too much about what happened in quarter 3, but more of what's coming up in the future here. So the first thing I wanted to talk about was a big thank you to you guys. I really appreciate the vote of confidence and support that we've seen with the addition of the MSO position. Brian Price is starting on the 26th of December. And we've already had a lot of conversations about what things look like moving forward, and I'm really excited about it. So thank you very much for the support. The other thing I wanted to talk about, so we'll go to that next slide. No worries. Yeah, and so the other thing I wanted to talk about is a little bit about what's coming down the pipeline in 2025. So again, I don't have too much to chat about with what's happened in 2024 here, but we do have a lot of stuff that's coming down the pipeline that I'm pretty excited about. The 2025 EMS training plan. One of the big changes that we're going to see is a movement from a lot of online training that we've been doing to more hands-on training. We're also going to see some revamps of some of the policies. So Chief Cermak has asked me to do a revamp of the infectious disease policy, and that'll be coming in February as well. And the QM plan and recertification process that's going to be happening too. So let's talk a little bit about quality management. So Dr. K chatted about this a little bit, but you know, the book definition of this is a structured approach to ensuring the best possible pre-hospital care is delivered for our folks, so our citizens, the people that pay the taxes. And really the best way to kind of think about this is what systems do we have in place at this fire department that make sure that when a citizen calls 911, we deliver really good care and consistent care, as Dr. K said. So we want to make sure that the care delivered in South County is the same as the care delivered in North County. So let's dive into that a little bit. We've got a few things that are like basic principles for our quality management program. And these are items that I think are really important to kind of keep in mind when we build any program. One of the failure points that we've seen in the past is when we have a culture of where feedback is not necessarily expected, or a QM program is looked at as punitive, you'll have folks that are a little less likely to provide self-reporting, tell you when something happens that didn't quite go well, and perhaps have a more collaborative approach when it comes. One example I have is a private ambulance company I worked at way before I got my first fire medic job. There was a medication error there, and it was one of these situations where a paramedic had two look-alike medications, where one was a hypnotic and one was a paralytic, and they accidentally used the wrong medication. And I saw how this agency kind of handled that process. It was very punitive, and it was like, what the heck did you do? What's wrong with you? And it failed to kind of look at the systemic things that were in place that made that happen. Why did this medication live in the same drawer with the same red top next to another medication that could be very dangerous? So one of the things that we have to do as an agency is when there's an issue, we look at gaps in our training. We look at inherent systemic issues that we can attack, as opposed to looking at the person. So this concept of asking why something happened as opposed to who did it is something that I really want to make sure is a base level for our quality management program moving forward. I really want the providers here at North County to think of feedback as routine, something that they're going to expect. And when something happens, let's have a conversation about it and let's learn from it. And we're much more likely to have that when that culture is there. I think that's in place already to a certain extent. We don't see a lot of punitive stuff, but we really want to kind of bolster that up. So what does the quality management program that we're working on right now look like? There's three main elements to it. The first is patient care record review. The second is key performance indicators. And the last one is call debriefs. And I'm going to deep dive into each one of those. So let's talk about PCR review. You know that anytime someone calls 911 and we go out and provide medical care, there has to be documentation for it. And that's in the form of what's called a patient care report. This serves a ton of different purposes. In addition to being used for us to look at it on the back end and see whether or not care provided was in line with Snohomish County protocols and our internal policies, it's also used by the billing department. It is also used by the receiving hospital to know what work we did. It's extremely important that this stuff is right. And it is actually kind of one of our weak points in the EMS division as far as the amount of scrutiny that's put into these chart reviews. And so we have a system in place now that kind of looks at charts as they come up with no system for it. For instance, there's no system in place right now that'll say this provider will have X number of charts reviewed every month or every quarter, right? That's a whole. And so our desire here is to make a QM plan that formalizes and provides structure to the work that's already been doing in a very informal way over the past couple of years. And you're going to notice that as a common theme with many of the EMS initiatives that we have coming up. We've been doing the work, but there hasn't been consistency and there hasn't been structure to it. So that's the idea. So a PCR basically says, this is what we found, this is what we did, and this was the patient response, and this is why we did it. It kind of gives us an idea of painting the picture. So we use ESO as our software program for writing patient care reports. It's called EHR. One of the things that lives right next to that patient care report writing software is a platform designed just for providing this feedback. Importantly, you'll know that HIPAA is something that we focus on all the time, so patient privacy. This is a way for leadership and providers to have two-way conversations and sometimes 5- or 6-way conversations with all of the paramedics and EMTs that were on the call, chiming in and having an exchange or a dialogue of information about what went right, what were our opportunities for improvement and how things went. So we do use the QM platform extensively to do this. And the providers can see the call and respond to the feedback, and we're already starting to use that. The goal with our PCR reviewers, so our QM team, is to take each one of these PCRs and to look and make sure that the patient was treated safely within established protocols and within the internal policies that we have at North County Regional. One of the other things that never had some structure around it was PCR reviewer guidelines. So basically a document that says this is how we're going to look at charts and this is the documentation expectations, because consistency across shifts is another point that we can improve. One of the things that I hear from our crews very frequently is, well, gosh, I work a shift rate or an overtime shift on another, and they do things completely different. You know that this can be dangerous on the fire ground. It can absolutely be dangerous for patient care as well. We all kind of want to systemize a lot of the things that we're doing. So there's a few different ways to include PCRs into the QM plan. We've developed, after looking at dozens of other plans in the region and also actually some regional ones as well, and some national ones, PCR inclusion criteria. So these are high acuity calls with high consequence that we will look at with 100%. And we haven't done that yet. So essentially the idea is, if you, I'm not going to list these out, but you can kind of see this list. These are the stuff that really, really matters in the setting of EMS. And each one of these charts is going to be looked at with 100% compliance. The other way that we can include PCRs into is just by a provider saying, hey, we had this call. I think it's got some really good nuggets for it. Can we have the QM team take a look at it? So there is a mechanism in place for a two-way street for QM, not just us looking at them and saying, hey, what's going on? They can also send a call our way as well. Our QM team involves designated peer reviewers. So these are paramedics and EMTs that work directly with the other provider, and each shift has a designated paramedic that conducts BLS run review, which is going to be incorporated into our QM plan and allow the paramedic that works with those EMTs day in, day out to do chart review with the EMTs as well. So it is very much a multi-layered plan. You'll see Dr. Corsa and myself and MSO Price doing a lot of the ALS QM and that shift level BLS QM. So we're really going to hit all of the different strata of the department. And then, of course, if a citizen or hospital or facility brings forth a complaint, there's also that third mechanism to get into our QM plan. We'll open up a call and look at it as well. I mentioned another way for us to keep track of our performance as an agency is something called key performance indicators. I think many of you guys have heard this term before. It's not something that's necessarily intrinsic to EMS. It's used in the corporate world and it's used pretty much everywhere. Well, we have these as well. KPIs are a really good way of objectively measuring whether we're hitting the mark when it comes to our patient care. And if we take a KPI, so a key performance indicator, we put it together with PCR review or chart review, that's a really good way of painting a comprehensive picture, and in a year I can come to you guys, the commission, and say we are doing well, and this is an objective way to tell you that we are doing well. So an example of that would be aspirin in chest pain. So this is a really common key performance indicator. We know that early aspirin administration in the setting of a myocardial infarction or heart attack really moves the needle, and it's one of the most effective therapies for that. And so we can say in our charts, when someone was diagnosed with cardiac chest pain or a heart attack, how compliant were we at giving aspirin? Well, since this was a KPI in 2024 that had a huge county level focus, you saw our providers have a 12% improvement from the beginning of the year to the end of the year, which means that 94% of the time now when your providers show up, aspirin's on board, and that other 6% doesn't usually mean they're giving it, usually means there's some outlying factor like an allergy to aspirin or given prior to arrival. So I'm pleased to say that following these KPIs and using these measures really does work. We do see when we focus on one and we use that as a training target, we do see the effect of it, and so aspirin's a really good example of that. Another thing to keep in mind is that KPIs can be a driver for training, as can chart review. So an example of this is, one KPI we track is first pass success in intubations. What does this mean? Well, it means that if I show up as a paramedic and I decide to take someone's airway, so put an endotracheal tube in their trachea, this is a very, very big intervention. It carries a lot of risk associated with it. And so it's one of those ones that's going to get a lot of scrutiny. We know that if I'm able to pass that tube on the first pass with success, there is a much lower rate of complications associated with mortality. So it's a very easy one for us to track. One of the ways that this process that I'm explaining, QM, can inform what we do as a training plan would be Dr. Corsa noticed a trend with contaminated airways feeding into a bunch of missed intubations for the first pass. So basically what that means is a lot of vomit and a lot of blood and a lot of nasty stuff was in the airway, and it made it so our providers were not able to provide that first pass success and get the endotracheal tube. Well, what's the example here? Well, Dr. Corsa was able to Frankenstein his in his garage, actually, he quite literally on Amazon and Home Depot made a device that took one of our old airway mannequins, and basically it's a drill attached to a pump that put simulated vomit and blood into this airway, and we used it in our CAM class as a direct result of, hey, we saw this pattern with our chart review. This is an issue. How do we fix it? Well, let's emulate the difficult conditions that they are seeing in the field as best as possible. And we still have that in play, and we use that contaminated airway mannequin today. So our QM plan, you guys can kind of think of this, directly informs and drives what we do for EMS training here at this agency, and it's going to continue to be a circular relationship as we move forward. The last thing that we do that kind of informs our QM plan is call debriefs. So I've done a couple of these in my new position at the formal level. Oftentimes it'll be a day or a few days after a call, perhaps the next rotation. What we'll do is sometimes meet on Teams. So we'll just make a Teams meeting real quick. People can join from their different stations, and over the course of about 20 or 30 minutes, we talk about what everyone's role was on the call, what went well, and what our opportunities for improvement are. It can be formal. More often it is EMS leadership, so paramedics and the captains and the captain paramedics that are oftentimes just sort of ad hoc doing these when we get back to the station. And this also filters its way up into our QM plan. And we go, boy, that didn't go well. How can we train on this? And it really leads to impromptu shift level training to address issues in the moment. So our EMS training plan that I'm talking about, that I'm going to show you here in the new year, this is also a great example of our crews are doing this training already. There's just kind of a lack of structure and formality and support for it as well. And so the addition of Brian is going to give us sort of a force multiplier to be able to execute on a lot of these things. So the last thing I was going to say, I just wanted to bring this up because it's sort of tangentially related to quality management. But one of the things that we also have that really helps us as providers is the ability to see what happens to the patient after we drop them off at the hospital. So this is newer in the last couple of years, but also in ESO, you can tell I'm a very big fan of ESO. They have what's called Health Data Exchange, which lives right next to our chart. So it's very easy to access, one login. And our providers, days or even hours after dropping a patient off at the hospital, can log in and see that patient that I was wondering what happened. Well, it turns out they were in a motor vehicle collision and they ended up having a pelvic fracture and an arm fracture. And that's kind of in line with what I thought. Or heck, boy, that surprised me. I didn't see that happening. And so what you'll see is these outcomes very much supporting our providers in sort of guiding their care in the future. It was one of the missing links as a paramedic that I had. One of the things I would do is call the hospital and nag the nurses. And of course, with HIPAA being what it is now, you know, unless you know the nurse, you're not necessarily able to get that information. This is a formalized way of our providers being able to see what the result of their work is. And so it's really, really helpful, and it helps make those connections between the in-field treatment that we do and the outcomes. So our own QM plan is in beta mode right now as we work to establish our workflows and structure. You can expect to see the finalized version of this early in the new year, probably mid-February or so. And the other thing, Dr. K mentioned this already. She said that quality management and QA/QI was a risk at the county level. I also see it as a risk at this department too. And so the idea is that this QM plan is going to dovetail, augment, and support the county QM plan. They're going to agree with each other. And it also offers the opportunity for, if we have something that involves perhaps a poor patient outcome that needs that higher level of oversight, there's also a mechanism for elevation up to the county level QM plan. So it's designed to dovetail and integrate with the county QM, and it'll bring us in compliance with a lot of the stuff that we're looking at. So I think that's what I have for you, and I'm happy to answer any questions about QM or what's happening in 2025 here in our EMS division.
Questions, anyone?
Oh, sure. Yeah, for quite a while now, I have been gently nagging Chief Krasky and Chief Tenhopen for a reserve rig to be used as EMS training for our crew members. And I'm happy to say that my consistent bugging of them has yielded what's going to happen in early 2025. We're going to take one of our reserve rigs. We're going to stock it just like one of our paramedic units. And one of the things that we suffer from here in this agency is that we're so far apart. So Station 99, Station 48, Station 46, we just have a very large geographical area, which means that it doesn't really make sense to take Medic 99 from Stanwood all the way down to Arlington or vice versa to do our EMS training. This is going to allow us to pull up in front of Station 99, knock on the door, say, hey, paramedics, EMTs, come on out. Let's do a scenario in the back of our EMS training rig. And we already have all the equipment to do it, so it's going to be a very low budget kind of item, but it's going to be really cool. So it's to give our Megacode Kelly, which is a high fidelity simulation mannequin that we bought last year, a nice proper home for her to live. So, yeah.
So something came up in strategic planning the other day that I thought was interesting. Our 2023 ROSC versus 2024 numbers for KPI. I think you said we were 43% successful in 2023 and 54%.
For ROSC or for Utstein?
No, ROSC.
Off the top of my head, I can't remember the 2023 versus the 2024.
But it had increased. Our KPIs had increased.
It did, yeah.
From 2023 to 2024, from what you stated in the strategic plan. The other one, how do we measure? I shared that in our strategic plan, some of the measurements we're going to come forward to show our effectiveness to the community is also sepsis. How do we measure sepsis, and how are we doing there?
Okay, so without having it in front of me, I can tell you how we measure it, but I can't tell you exactly where we're sitting. I can tell you anecdotally we're doing very well in our providers. This is another KPI that we focused on over the last couple of years. So the way to measure that would be two ways. Number one, we could use the primary impression in the chart of sepsis, or we can use the outcome at the hospital of a final diagnosis of sepsis and see whether or not we were able to correctly identify it. It's going to be one of the KPIs that we focus on a little bit further. But I will say, Chief Cermak, that is one of the more difficult KPIs to track, because anytime that we have a few different pieces of data that we have to mine and the charting isn't done exactly the same every time, it gets to be a little bit more difficult. So that one would be a little bit more laborious. Aspirin is a good example of one where it was given or it wasn't, and the primary impression was this or it wasn't. So
And we've improved there in 2024. What about stroke KPIs?
that's another one that is very easy to track. One of the KPIs that we track in stroke is, did our providers obtain a blood sugar when the diagnosis was stroke? It's another one that we're in the low 90% on now after a very big push in 2023 and 2024. So
Awesome.
Yep.
Great job in the 2024 EMS.
yeah. Thank you. Appreciate it.
Thank you.
Yep.
Okay, next we have the third quarter support services report presented by AC 10.
Hoping, 10 hoping, right. You're hoping for a 10, remember. Never forget.
Frequently mispronounced.
It is.
Doug
But I answer to everything.
Doug has schooled me into how to say it.
Good afternoon, Commissioners. Next slide, please. If you recall, this is the third briefing now from our division to provide to you. You've noticed that, one slide back, please. So the first briefing I gave you was on apparatus. We did a full briefing on that, and then did full briefing the next quarter on facilities. Today's briefing is everything else that I do in our division for the department under my leadership. Okay, the quartermaster program. So the initial issue of our part-timers and full-timers goes through the quartermaster thing, and that is also when it comes time to replace items. So there's the initial issue and then the upkeep of their items, and it's usually is there something get torn, somehow taken out of service, or just wear and tear and needs to be replaced for one. A lot of that depends on inventory management to make sure that we have on the shelf what our firefighters need to ensure that they can go on to the next call with what they have. Big thing about relationships with our main vendors, because at a moment's notice I may need to make a phone call to get something really quick, and they've been super working with me. So I think that is an important part of this job, is to keep those conversations going. And of course, there's a big budget management related to quartermaster program, just because and especially since we've hired 30 plus people in the last year, we're up to 130 or so total personnel in the department that need to be outfitted. On the structural PPE side, besides the turnouts, we have a lot of other equipment that we issue. I also help with the SCBA program by issuing the masks to each of them. And I help niche out in the wildland thing by issuing the wildfire jacket. It's just easier for one-stop shopping up at the quartermaster shop to get all that stuff done. For our repairs that we need to send out to Northwest Safety Clean and to do advanced inspections, that's about a 5 to 9 week turnaround, unfortunately. So that is something where we try to get ahead of the game and have inventory on the shelf to replace for those our personnel to use while their gear is at Northwest Safety Clean getting repaired. Mask and helmet repairs, we usually a phone call happens and the guy can show up within that day or the next day to repair a mask for us, which is very, very nice. And then a lot goes into the replacement planning as to looking at folks' dates of their gear and then make sure that we have a rotational basis where everybody's gear is not expiring at the same time, creating a budget disaster. Next slide, please. On the project management side, so new construction was really big this past couple of years with the training center going up. We're wrapping up the two most recent projects on there, which was the strip mall prop and the support building. So that's the one that is the DNR's leasing a portion of the space from us. So those things are wrapping up. Besides being the owner's representative to work with the general contractor and the architect and engineer, there's a lot of stuff that the owner's representative will do with subcontractors that are not part of the original bid. And there's examples up there for some of those folks that we had to deal with directly to support the project that we didn't go through the general contractor to do for money saving purposes and for other reasons. A lot of inspections. We have a third-party tester company that comes in, has to do all the testing for their Department of Health, Department of Ecology, Department of Ecology. And then tracking the budget is a big thing there. Attending meetings, schedule tracking. There's a lot of stuff. The chief will have a question, or you will all have a question, and I'll have to have all that information at the ready. So there's a lot of that goes on while we're doing everything else in the job. Major renovations, that's the other thing. We have, you saw that the past year we did those backup generators at 46 and at 48. Put new learning systems in at 48, and now 99 just finished theirs, the diesel exhaust extraction systems, and there's several of them there. That is a lot of coordination that happens between getting the required bids from 3 different companies as a minimum, going through all that timeline. Sometimes it requires that we have to bring in a subcontractor to support something. So for example, when we have this new extractor coming in that our safety chief was able to get through the fire program, when that arrives for the training center, I have to coordinate with the electrician and with the plumbing to get the right electrical power to it and the right plumbing associated with it. So a lot of it, there's a lot of coordination that goes on in that. So next slide, please. Emergency management side, Stanwood ILA, we have a big portion of emergency management with the city of Stanwood through that ILA. I'm the mayor's representative and voting member on the DEM advisory board. I've driven a few times with the mayor to DEM to conduct EOC training quarterly. That's been a wonderful time to sit with the mayor and get some insight from him and where he wants to go with the emergency management program. So that windshield time plays a big role in our success with the city of Stanwood. I'm currently working on changing out the IT equipment here for the EOC, which is where you're sitting right now, is the Stanwood City's EOC. I'm putting out a weekly flood forecast during the flood season right now. You'll see that on the next slide, what that looks like. And then, go back one. And then we are also helping out the city of Stanwood with the annexes to the county's comprehensive emergency management plan and hazard mitigation plan. And then on top of that, we're working with just on the non-ILA side, but with the emergency management for the chief here at the department. Participated in the active shooter training exercise we did at Warm Beach Camp, and then the Stanwood High School recently did a reunification exercise that we participated in. Also reviewing incident action plans for this Stanwood Command Affairs, as an example, and then working with the pipeline agencies here for all the pipelines that go through our district and BNSF. Next slide. That's the weekly quad chart that I put out to the City of Stanwood Mayor and the City of Stanwood Police Chief and our Fire Chief, as well as the City of Stanwood Public Works Director and City Manager and all the battalion chiefs and Chief Kraske. So they have an idea of what the next forecast is for the upcoming week. Do we have a lot of precipitation? Is there going to be a flood? If there is a flood, there's a triggers that list there, and it's always on the quad chart each week, so that the battalion chiefs can review that and reference it to know if they need to go out there and start driving the area for monitoring if the river forecast flooding is forecasting as or is proceeding as forecast. And then I threw in a QR code, so at any time you can get the immediate current river gauge level at Arlington to determine whether if it's is in fact going to go to the flood stage. Next slide. Next slide, please. The administration side, this is the one job that I am probably spending the least amount of time on, but now with the closure of the strip mall prop and the storage building construction, I'll be able to spend more time in this one. And I've been working with the chief and talking about some ideas to improve our policy manual, and with Allison as well. And we have a good plan going forward, and at some point we'll brief you on that. But this is the one thing where I feel bad that I have not done more for the chief when it comes down to the administrative side of my position. Next slide, please. Grant, so I write most of the grants for the department and help a couple of the other divisions with their grants. Randy and I do the management. Randy probably does most of the management, but for any grants that we do get awarded, there's a certain management requirement that goes with that. And it's just, you can tell at the bottom of the chart there that since I've been here, we brought in over $1.7 million worth of grants to the agency. So excited about that. And that pretty much wraps it up. I try to go a little bit quick because I know that we've been here a while, and Matt's brief before me was one that couldn't go as fast. So, yes, sir.
Very quickly, City of Arlington Emergency Management, do they handle it all themselves or with the county, or are we cut out of it?
We're not part, it's not in the ILA for us to provide emergency management services for them. If they wanted to enter into that, they could with us. I know that when I go down to the EOC training with the mayor, I often see the City of Arlington mayor there also. But we're not by ILA.
So the invitation's there, they just haven't asked us.
Correct.
Okay.
Yep.
When we did the RFA planning process, we extended that, and they were not interested at that time.
Okay, all right.
Any other questions?
Thank you, Chief.
Okay, thanks. Sir.
Next, we have unfinished business, and
Yeah, that's right.
we'll be having a presentation by Finance Director Randy Crowe.
Great, thank you, Chairperson. Good evening, Commissioners. Randy Crum, Finance Director. Before you tonight, I have presented the Resolution 1211-2024-01, which is our 2025 annual budget. On the second page of the resolution, you'll see all of our funds laid out by name, my number, and then total resources or revenues, and then total uses or expenditures. And so we are providing this to you tonight in the total of $32,800,973 for all funds for next year. This is virtually the same exact budget we looked at a couple months back in our budget workshop. The only thing we've really updated, we finally got insurance numbers last week. And so I did incorporate those, and they came in slightly under what I had projected. So So if anything, the numbers might have gone down slightly, but we've not changed any positions or number of positions or salaries, nothing. Everything we presented in the workshop is still in here. Obviously, we have some things up in the air, CBA negotiations, other items. So as those come to us in the upcoming year, we may need to do a budget amendment to address those in the budget. But for now, this is our good feeling budget, and with levies passing, this hopefully will carry us through. So I ask for your consideration and approval tonight for the budget resolution.
Just a question, Randy. What is a GO bond? I know you've said that before.
That stands for general obligation. So it's not a voted by our citizens bond. It's one we can just issue on our own, and there's thresholds. We can only do that up to, I think, 0.75% without going before our citizens for a vote. So it's just general obligation, and we just take any debt we issue as general obligation. We take out of our property tax proceeds. Is what we're pledging to pay those back with.
Thank you.
Mm-hmm.
I'll make a motion to approve resolution 12112024-01, adopting the 2025 annual budget.
Second.
All those in favor?
Aye.
Aye.
Anyone opposed? That motion carries. Thank you, Randy.
Great. Thank you so much.
The next item is the compensation study update, and that will be given by Allison. You are Human Resources Director.
Point of order, very quick, excuse me, real quick, I'm sorry, question to Budget Director Crum. Do we need to sign off on this resolution tonight before we leave? I mean, for time or anything?
I believe our secretary will send it out through DocuSign.
Oh, okay, so.
We don't have the same constraints we did at the last meeting for the property tax.
Oh, okay,
That one
okay.
we did have to do immediately and send that.
Well, that's why I was asking now.
We'll get our property tax.
I just wanted to be sure that we were okay on that. All right, fine.
Thank you.
Excuse me.
No problem. So, good evening, Allison Jubb. Now I'm really losing my voice. Is this on? Yes. Allison Jubb, Human Resources Director. Thank you. This is a very brief update for you, but I wanted to make sure that those of you who are not participating on the compensation committee as part of the compensation project that's underway, you just have a little bit of a taste of what we're doing and keep you apprised. So just as a quick reminder, there are 6 deliverables that we have. So you're going to be seeing, and we're going to be conducting 6 different pieces to this compensation and benefits project. Very quickly, we already did the compensation philosophy. That's finished. We are underway collecting market pay information about each employee's position. We will be doing a salary structure. So today in our compensation committee meeting, we were able to talk about what goes into a salary structure. How does it get designed, aligned with the compensation and benefits philosophy statement that we talked about at the last meeting. So I think that was a good underlying base of information there. We have updated on an initial draft all of our job descriptions for our non-represented employees, and we will be providing those to Chief Cermak after we make some more edits for his review and consideration. And all of those were, we had all employees have an opportunity to provide input into their own job description, which is really important to us. We are talking about what goes into the compensation policy and how is pay issued. So we're starting to have those conversations and maybe collecting bits and pieces that will eventually go into a draft policy for you all. So that is also underway with the informally with the compensation committee. And then the last piece, remember that the benefit side, the other side of compensation and the other piece of it, we are going to have some of that might tie in by the 22nd of January, but some of those things we're talking about, but we'll be setting them aside for maybe further action later. So had our first meeting today. I think it was, well, they can certainly weigh in on that, but I think it was very helpful to get a good foundation, and I think you'll be pleased with all the work and effort that goes into their efforts being on the committee before it comes to you on January 22nd. So any questions at all on the work that we're doing or the process and so forth?
Well, you make the comment, the work that we do, it's the work that you do. It's amazing how much work you've put into it, so thank you.
Thank you. You're welcome. It's a lot to it. It's important to, we never can get perfection, but if we make a good chunk of improvement, we'll just continuously do that over time. So thank you very much.
Yeah, I thought you did a great job at the first meeting today.
Great. Thank you. Any questions at all? Anything else you want us to talk through? All right, we are pressing on then. Got more meetings scheduled and we'll just keep rolling.
Need to give those vocal cords a rest.
I know, yeah.
Yeah, thank you,
Perfect.
Allison.
Thank you.
Next, we will move to a new business, and we have needing an amendment to the budget, and Randy will present that.
Yes, thank you. Thank you, Commissioners. As you recall, a year ago, we set a budget for 2024. We've been very successful in keeping within the amounts that were authorized by the Commission a year ago, all except for one fund. We do have an employee leave reserve fund that was established when we merged with or annexed in Arlington. And so we have $500,000 to $600,000 in there. And what that is used for every year is when a person retires or leaves our employment, there's some cash out of some of their accrued leave. So we budgeted about $100,000 for that this year, which is about typical. However, we had 3 long-term employees leave our employment this year, and so it actually ended up being about $155,000 worth of cash out. So that exceeded what our prior authorization was. So we just need to do a little housekeeping resolution here, amending the 2024 budget just for the employee leave reserve fund. So I bring that before you tonight for your approval.
I'll make a motion to approve resolution 1211202402, amending the 2024 annual budget.
Second.
All in favor?
Aye.
Anyone opposed? Thank you, that motion carries.
Thank you very much.
And next, we have Allison once more with the overtime correction, authorization of an
She
overtime.
can present it in sign language.
Yeah.
All right. Thank you, Allison Jubb, Human Resources Director again. What I am asking for you tonight is to pass a motion, really 3 motions, that all are pertaining to the activity that's underway to correct overtime pay for a 3-year period of time. As you know, we have a collective bargaining agreement that has a definition of what overtime is. It's been there since, I don't know, the dawn of time when we've had this collective bargaining agreement. And as we were digging into that through negotiations, realized that how overtime was being calculated and what the sort of base was inadvertently not including, by definition, some additional forms of pay. So your longevity pay, your education pay, and so forth. We need to include those by statute when somebody works in excess of the amount under the Fair Labor Standards Act for their pay period. In this case, it's, let's say for the 24-hour employees, it is in a 24-day period working in excess of 182 hours. So we're going through that process. We had originally hoped to be able to have all historical corrections done and paid in the month of December. It is proving to be more complex than it first appears. And so instead what we're going to be doing is taking this in phases, looking at taking all of 2024, getting it all corrected, meeting with the union, making sure that they can look at 2024 and see these are all the forms of pay that go into your overtime rate. Does everyone agree? And get that buy off before we proceed with everything else. And then what we'll do is pay each year as it gets calculated. So as soon as 2024 is done and we have the buy off, then Randy will process pay for that special thing doing 2023 and 2022 and so on. There is a typo on this proposed agenda bill. in the expenditures requested section, it says not to exceed 100,000, but you'll notice in the motion, I actually changed it to 125. I don't believe that we'll reach that, but I wanted to give enough leeway that I don't have to come back again and ask for more if we need a little bit more. Although if we run out, we will obviously do that. So before you, I have one is to authorize us to proceed as we get each year audited and agreed to and move forward to pay that. The second motion and the third motion are about bargaining impacts and implementation with the union. And I know this is really unusual to come to you and say, give us permission to move forward without an MOU in hand. But given the time and the impacts, we want to really move forward as quickly as possible. So this motion actually, the first one, the middle one is a motion that allows myself and Chief Cermak to negotiate with the union the impacts and implementation, reversing a temporary fix that we had to put in place, which is starting September 1, and we believe it'll go at the most through January, overpaying on overtime just until we figure out how we can get our system set up, our manual processes and so forth. Then after that, we'll be back to the normal way that we should be doing overtime, which is sometimes you'll get that higher FLSA rate, sometimes you'll get the contract rate. And that's really what we want to do is we've got to undo that. And we know it's a temporary fix, but at some point we've got to get to the right normal way to approach it. And then the very last one is a motion to really just address the non-monetary impacts and implementation of just doing those payroll corrections. So these might be things like making sure that we give employees notice and having them take a look at what we think their pay provisions are and so forth, communications out. That's really important, obviously, to us, and certainly it's important to the union as well, that employees really fully understand and feel really clear about what it is that's being paid and why. So those are the three separate motions that I have for you.
I move to authorize payroll corrections for the period of August 1st, 2021 through August 31st, 2024 for all impacted employees in an amount not to exceed $125,000.
I'll second.
All those in favor?
Aye.
Anyone opposed? Okay, that motion carries. Thank you.
I move to authorize Fire Chief Cermak to bargain the impacts and implementation of reversing the temporary payroll provision using only the Fair Labor Standards Act overtime rate calculation while the historical pay audit is underway, and authorizing Chief Cermak to execute an associated agreement with IAFF Local 3438 necessary to effectuate the agreement reached.
Second.
Okay, we have a motion and a second. All those in favor?
Aye.
Anyone opposed? Thank you. That motion carries.
I move to authorize Fire Chief Cermak to bargain non-monetary impacts and implementation, if any, associated with the payroll corrections between August 1st, 2021 and August 31st, 2024, and authorizing Chief Cermak to execute an associated agreement with IAFF Local 3438 as necessary to effectuate such agreement.
Second.
Okay, all those in favor?
Aye.
Anyone opposed? That motion carries. Thank you.
Thank you very much.
The next item on the agenda is the chief's report.
All right, thank you, commissioners. NCRFA staff participated in another negotiation session, as you heard earlier from the local Vice President Kirk Norman, and we did see the first poll at their presentation for a wage analysis. So we are working on our response that will be prepared for the next meeting. We were unable to come to agreement on continuing an L&I fire program that we had a MOU for in the past, and it must be jointly approved for us to move forward. So we can expect an increase in our L&I premiums unless the MOU is signed before the 20th. There is a cost loss in the amount of about $45,000, not if we don't come into the program for L&I. So we've prepared, and it's not necessary for me to bring forward an MOU with you guys because we're actually losing money. So I'm trying to keep us from losing money. We've prepared an MOU with the local, matching the same MOU that we've had in the past. If they choose to accept that MOU by the 20th, then we would continue receiving that. And that MOU states that we share that amount of money of approximately $45,000, 50% that goes back to their wellness and fitness program or equipment that we have in place. So that money will go away if we do not receive a response back with approval of that MOU. Following the negotiation session, a lot of work has been completed researching comparable agencies' total cost compensation for further discussions. And again, we'll meet with them after the first of the year in that meeting. I attended the Snow Isle Commissioners meeting virtually. Commissioner Schreiber was selected and elected as the secretary role for the Commissioners Association. So congratulations on that, and thank you for doing it. They had gone a little wise without people interested in that. So thank you. And as you heard earlier, the Santa runs have started and haven't disappointed. The first 2 nights, I know they were huge. Carrie and her husband were out there, Dave. I attended one of the 2 nights, and we had Rotary one night. We had council and city staff another night from Arlington. And I think they received somewhere about 5,000 pounds in 2 nights. So quite a part. Now we're sort of starting to transition into Santa runs into Stanwood. So we'll see if Stanwood could represent the same way as Arlington, because those 2 neighborhoods were incredible. Commissioner Ertley, Commissioner Oakes, Chief Kraske, HR Director Jubb, Local 3438 representatives, Commissioner Nordstrom and Chief Schmidt met to discuss services to Fire District 21, specifically an RFP that they put forward with us. We'll meet again on January 9th, 2025, and see if we can come to any more agreement or none with that. So they're going to present tonight at their commission meeting as we speak. So we look forward to seeing how that goes. There were 3 half days of strategic planning that were conducted during this period. I was super excited with the consultant process. I would like to thank the mayor and police chief of Stanwood, both constituents of the RFA, for attending. The police chief of Arlington, also an RFA constituent, our 3 commissioners in attendance. The staff that took their Saturday and 2 days, Monday and Tuesday following, and our 4 firefighters that participated in the process. As part of this, we'll outsource a standard of cover recommendation from a renowned data specialist called FireStats Incorporated to update our standard of cover of what he or they recommend from a national standard. We'll do some, because we didn't also have a huge interest in citizens, we're going to take some of the questions, it's 5-question part, and do a random sampling of the fire district, City of Stanwood and City of Arlington, and send a mailer out to them with the same 5-question random sampling to the citizens to see if we can get more citizen input. We did have our mayors and such that were invited, so we're going to do that. And we expect to have something back to you for first review of commission in February. But it was super good process. It was interesting to see that they recommended some of the things that Dr. K reported on, and Matt Hickman shared our success of, we've been increasing from 2023 to 2024 in our outcomes of our major incidents. So we'll have a better way of measuring that and showing the community what we do, rather than just word of mouth of what someone's impression is. So with that, obviously you heard Allison with no voice, that she has put a huge amount of time into this. Randy is now dealing with the accountant, and just kudos to them. There's just been an exponential amount of work done by those individuals. So thank you guys. the proof is in the product that you've seen. So that's the end of my report unless there's any questions. Yes, sir.
You get Chief Spain's PowerPoint?
I did. I will forward it to you. I'll forward it to the whole commission.
Well done.
Next, we have board discussion and commissioner comments. We need to decide whether we want to have another meeting on the 23rd, which is Monday, or do we want to just wait till next year? Do we have anything that we need to discuss?
Could I make a motion that we cancel December 23rd's meeting?
Yes, you can.
December 23rd.
I think
Did I
we
s-
have a motion.
Did I
Well,
say 23rd?
Is that the chief's recommendations or the finance director's recommendations in terms of, is there something that has to be finished between now and the end of the month?
Well, I mean, we're gonna still issue some vouchers and pay our bills, so we're current.
Yeah.
But we'll just get caught up on our approvals first meeting in January.
But the
And we
budget
have an
is
approved
for-
budget?
Right, exactly, but I didn't know if there was something else
No, I'm all good.
hiding out there, otherwise,
That's
at
a
least
good question.
keeping a quorum of 4.
We'll
at least
promise.
On standby for the
We'll,
23rd.
we'll promise a little longer meeting on the 8th or 9th, that Wednesday.
Yeah, no,
Not that.
no, that's
Okay, we have a motion, and do we have a second?
Second.
All those in favor?
Aye.
Anyone opposed? Okay, that meeting is canceled. Woo! Everyone have a Merry Christmas. Okay, next we have for the good of the
It's
order.
not to adjourn yet.
Anything?
I'd just like to thank the North County employees, the admin, and the firefighters for taking their time to go out and raise or collect donations, take Santa on the fire truck, and collect the food and dollars for the community. So.
Can I just tag on to that, and also the amount of work that Nitch Saka puts in? I mean, the entire group does a fair share, but Nitch, to put this all together, he puts a schedule together. He just is a rock star. Carrie's going to help him a little bit next year, modify the maps. She wants an improvement. She's a driver, but I just tag on to Commissioner Oaks that Nitch leads this thing and does an excellent job. Everyone does an outstanding job, and it's amazing just to watch the faces. So great job.
And on top of that too, Vice President Norman spoke about the firefighter group raising or
yeah, for
donating
those kids,
$3,000 and making those 10 families or the people that they've adopted, making the day great. So.
Yeah. Amazing. I do have one humorous thing. The night of the Santa, with a food drive and that, I go, well, we live on the top of a hill, and I sensed they were down there, and then the lights and everything, and then next thing I know, my granddaughter comes running in the house as fast as she, and then I see all these lights coming up the street, and I'm like, oh, God, what has she done?
It's funny.
And then I realized
That's
it
funny.
was she says, where's the food? I gotta have to take the bags out there and everything. But that flashed through my head, where she's running up the hill.
That's funny.
Anyway, I had to
That's funny.
share a little humor of the night.
And I wanted to add one other thing about food drives, and that is it's contagious to other groups. For the first time, I've lived in Candle Ridge development above Pioneer Hills since 2011. And for the first time, the Homeowners Association just had a food drive over the last week. So if bags are a little bit lighter with the fire department going through, it's not a reflection on the fire department, it's actually a reflection on their success of promoting food drives by others, because it isn't just their job, it's everybody's job to do that, to donate to food or donate cash, whatever. But anyway, so just want to thank everybody for that. But as I said, we had one also in our area.
There might be some warm brownies at our place when they come pick the food up.
Okay, I think
You've
that's-
got one of the few driveways that's big enough for a rig to turn around in. So, yeah.
for tonight. Do we have a motion to adjourn?
I suppose that's my job. I
I
make
think
a
so.
motion to adjourn.
Do we have a second?
Second.
All in favor?
Aye.
Anyone
Merry
opposed? No, we are adjourned.
Merry Christmas. Got 2 weeks from today.